Good morning and welcome. My name is Jordan Stenzel, and today I, as your newly appointed Executive Director for the Healthy Community Brookfield, am going to be presenting a point-in-time study about where we are and the strategic plan of where we're going forward to you, the Board of Directors. And I hope that we gain your support through this. Myself and leadership have taken a lot of time to assess and analyze our strengths and weaknesses and how we can improve them going forward in the next 5 years. So here we go. Just a little overview of the organization for those who have forgotten or want to recap. Um, the HCB is a 501c non-for-profit charitable organization. It was started over 20 years ago in 1998 when it was separated from the visiting nurse agency that was part of the local health department. Since that huge charitable donation was given to us to form our own agency, we have become the largest community public health nonprofit within the Brookfield County and the city of Dayton region, serving over 85,000 residents and growing, most of those individuals in rural communities. Here is an exhaustive list of the programs and services that HCB currently provides. Starting at the top with women's health and primary care medical services, which is the cornerstone of what we provide. Natal, prenatal, and newborn care, mobile health services, employee services and wellness, case care management services for the elderly, violence prevention programs, smoking cessation, diabetes education and prevention, teen health, after school programs, school health wellness programs, wellness and fitness programs, and also well water testing and water problem mitigation programs, as well as our vaccination and immunization programs, which are some of our biggest, especially during the time when school goes back in session. Some environmental factors that are going on the outside of our agency that I have gotten wind of and that others in leadership have made me aware of is that currently, from a community standpoint, HCB appears to be doing good. And I think that's just because of our overall presence that we have in being such a large community health nonprofit. Stakeholder relationships, however, are questionable, as many people from local law enforcement to the local hospital system in Brookfield to our county politicians are not sure of what we do anymore. They're a bit confused, and I'm hoping that today I can show a path that we're going to remedy that situation. In addition, the lack of Brookfield County official support is a major environmental factor. One of the issues that came to my attention is that county officials are constantly frustrated that every year HCB is asking for more and more funding to keep the program going um, on a yearly basis, which just doesn't show us in a kind light, especially for the good work that we do. And then finally, funding that primarily comes from the county health department. I understand that at one point this agency took in generous donations from wealthy benefactors and whatnot, and it doesn't happen anymore. So therefore, we're constantly having to be on guard and having to use public resources like grants and contracts. Unfortunately, though, those funding sources are scarce and they have a high rate of ending after the program is completed, and therefore we lose very good employees and services as well. So I did a SWOT analysis on the agency, and this is what I came up with, and I'm going to go through this very quickly for you. The strengths of the organization are the variety of services and programs. As I said, we have a lot. Our 20-year history in the community, being one of the community's largest employers. We have over 97 people at this point. And for a rural community like ours, that's a lot. And the people in this community depend on that. We're viewed overall as a good place to work. And I think that's a good starting point to jump off and become an excellent place to work. Now, we do have some weaknesses. Because of our contracts, agency turnover is continuous. Our employees internally continue to question our mission and vision, and I think that's just because they're unsure of what they're doing at this point. We've been kind of just running with the coast. Primary funding is depending on contracts and grants, as I have mentioned before, and we have no strategic plan in place. Leadership before I got here seemed to be doing things differently. But we do have some opportunities, right? Doing good in the community. Number one, first and foremost, the possible accreditation opportunities. The Public Health Accreditation Board did come through here not too long ago. Now, although we didn't get the Title IX for Domain 9, that is still an area that I think that we can achieve, and it'll put us on the map. Education and outreach opportunities. We need to expand those in the community to show people what we do and to bring more patient volume in. Interest in our community stakeholders with HCB, I think, is paramount. If we can build good relations with those stakeholders in the community, more opportunities will be brought our way. Now let's talk about the threats that stand in our way. The community confusion overall for what HCB does, we can certainly alter that. HCB did not meet the domain Title IX standards. This is a big deal to me. This shows that our agency is not on the right path that it needs to be, as all other community health nonprofits are slowly but surely meeting this accreditation standard. We too can do that, and I have a plan for that. And also the possible loss of contract and grant funding sources. Recently, I made a phone call to the local public health director and explained to them our situation and made a deal with them about what we're going to do going forward in order to keep those grants going. So here are my strategic plan recommendations. We're going to first redefine HCB's mission and vision. The one we have is a bit lengthy and outdated, and I think it can be simplified for our time that will directly point people to where we're going. Great community relations with the Brookfield stakeholders. Like I said, our relationships have been questionable at best. I think that with outreach, education, time, and our presence, we can show people what we're really about and change minds. Becoming funded by multiple revenue streams. This to me means going back to our roots and becoming funded by people in the community who are donating generously to us because they see the benefit we give to the Brookfield County residents and those in the city of Dakin as well, and not just depending on grants and contracts, which we know are unstable and can end at any moment or when their cycle is done. Finally, and most importantly, becoming Domain 9 accredited through the Public Health Accreditation Board. I can't stress this enough. This needs to happen. It will open doors to federal funding and state funding as well, and it will allow us to show credibility among all of our stakeholders for what we're about. So let's start with the old mission and vision. The old mission was this. As a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. Whew, that's a mouthful. The vision statement. As a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthy individuals, and healthier communities. Also a lengthy vision statement, which I think can be simplified greatly based on previous experience I've had in other organizations. So here's what me and the leadership came up with. In a nutshell, the mission is to provide extraordinary and affordable medical, behavioral, and community health services to individuals and their families in the Brookfield County. The vision, a Brookfield County community where all residents have the opportunity to achieve optimal health and equality. Now, how we're going to do this strategic planning process is simple. Like in my last employer, we are going to work with leadership to establish quality assurance and performance improvement groups. We shorten this and call it a QAPI group. Each department is going to meet on a weekly basis with their leadership. Each department leader is going to meet with the managers and supervisors and work in this QAPI group to come up with strategic goals that they want to aim for, whether it is outreach, counting the number of patients that we're bringing in, the number of patients we're seeing. The point is that we want measurable things, objectives, for each department that we can bring when accreditation comes back to reassess us in 6 months for Domain 9 accreditation. I want measurable results, and a QAPI group can do that. And we can coordinate all our efforts together each month at an annual QAPI meeting. And one part of this is to have a quality team. So I'm going to use discretionary funding that we have to hire a manager for a department of quality, as well as a specialist and a consultant. And I'm about to get into the next part of that. Part of QAPI is also going to be part of another thing called PAM, or Patient Activation Measures. This is going to focus on patient satisfaction. By being able to prove what we're doing and showing that we have people that are at the bottom of the totem pole, which means they're not really that satisfied, they're not that activated with their care, and show that through our interventions, through care planning with them, that we can increase that patient activation from a 1 up to a 2 to a 3 to a 4. We have data that we can bring to community stakeholders and show them that we mean business, that we're changing health outcomes. And this improves our image with the public interest and will bring more community stakeholders on board with what we do. Finally, I am currently in the process of working with the county health director and community stakeholders to build good relations. I've been going around touring with people as well as making phone calls to local officials that I can not meet in person and explaining what my plan of action is and how I'd like to address their needs and see what their issues are and really do a good community assessment on things and move forward from there. So that's what we're looking at for the 5-year process. Here's the estimated budget at this time for the strategic plan. We've budgeted around $110,500. We're going to probably spend around $103,000, which saves us about $7,500. And this is from our discretionary budget. So first we need to license PAM from the Insignia group, like I've done at previous healthcare agencies I've worked for. It's about $10,000 to get the license, but once we have it, we're able to survey up to 2,000 people at the beginning of the license, which is amazing. And that's going to really bring in our data to show our impact. We're also going to hire an outside consultant from the Insignia group, which costs around $2,500, to guide us through the beginning steps of the PAMing process, which is then going to be taken over by our quality manager, our quality specialist, and our quality consultant. These individuals are necessary in having their own department because they're going to work hand in hand with all the other departments that we have in HCB to improve their status, improve their patient outcomes, improve their overall program objectives and goals. This is going to lead to improvement with our stakeholders, as well as passing that Domain 9 standard that we're looking for. Ultimately, this leads to better health outcomes, securing the public interest, and finding new sources of revenue that we didn't have access to before because of our new efforts. And with that, any questions? Thank you so much for your time. Have a great day.